Welcome to Live with the Eczema Doc, brought to you by Clean Body, where we believe that you can heal your skin from within by cleaning your body. I'm Dr. Fong, a naturopathic doctor specializing in eczema, and I'm here to guide you through the journey of understanding the root causes of your eczema so that you can finally achieve the clear, healthy skin you deserve. Each week, we combine research-backed insights, science-based strategies, and my years of clinical experience to uncover what's really triggering your eczema and how you can take control for lasting relief. Let's dive into today's episode and uncover the next step to healing your skin from within. Are heavy metals causing your eczema? Do you have toxic skin? That is the question we are answering today, and this can really be a hidden culprit behind your eczema, one that you may not know about, that no one has ever asked you about, that you definitely have never gotten any labs for, and not gotten any assessment for. So I'd like to talk about all of that today. Why should we be worrying about heavy metals? We're going to talk a little bit about, how will we do testing? What can we do to really kind of lower our heavy metal burden? And why is this important? Why is toxic burden on our system something that can really wreak havoc on our system and lead to inflammatory diseases like eczema? Okay, so definitely if you have eczema and you have not thought about this yet, this is something you want to think about. So, first of all, what is toxic burden? It is the cumulative exposure to environmental toxins and harmful substances that accumulate in the body over time. These toxins can disrupt your healthy function. And unfortunately, we are surrounded by so many toxins in our environment in today's world. That includes everything from heavy metals to pesticides to mycotoxins. These are the toxins that come from molds, air pollutants, ingredients that are in all of our products, even our clothes, food additives, food dyes, and the list goes on and on and on. And unfortunately, this is something that we cannot get away from. And so we just need to do our best to educate ourselves and to understand how we can avoid these exposures as much as possible. Then, how do we clean up these exposures as well? So, today we're really honing in on the toxic burden from heavy metals. These are naturally occurring elements. They have a high atomic weight and density. But even with small exposures, these can cause harm in our body because they can accumulate over time. They can stay in our fat, in our tissues, in our bones, and they can wreak havoc. Examples of heavy metals include lead, mercury, arsenic, cadmium, nickel, and aluminum. I would say this is also the list of the heavy metals that I find quite frequently in my eczema patients as well. So there are many sources of exposure. We have these everyday exposures that we get from the air, indoor and outdoor, potentially our drinking water or bathing water. So basically tap water if it's unfiltered. The soil in which our food is grown. So the food we eat can have heavy metals. The food packaging, maybe we're exposing ourselves to aluminum cans and tin cans and things like that. If we work in certain occupations like the mining and smelting industry, the manufacturing industry, or construction and demolition, we might be getting exposure in our occupational settings. And then our products, unfortunately, our cosmetics, our lipsticks, our eyeshadows, our jewelry, the toys that our kids play with and paint on the walls, even paint that we paint with, that our kids paint with, can have heavy metals. Medical treatments like dental amalgams, those are those heavy metal fillings that are made up of 50% mercury. Vaccinations can have some heavy metals like aluminum, medications. And then we are also potentially getting exposures through smoke, tobacco smoke, lead paint, lead pipes, lead plumbing. So we're really getting these exposures potentially in all of the places of our lives. And so we really need to look into this. Food is a big one, as I mentioned. And our main sources there might actually be our fish, unfortunately, because our fish is so high in omega 3s and really great nutrients. But unfortunately, a lot of our fish can have high mercury. So these are all places that we can have exposure to heavy metals. So, what's the problem? Why does it matter that we're exposed to heavy metals? Well, I like to say at Clean Body that everybody has what I like to call a clean body funnel. And this funnel for me is made up of all of the processes that we need to do, from eliminating waste to protecting our body and regulating our hormones and providing structure to our body, intaking fuel and distributing all of that fuel. And when this funnel gets clogged, then we just can't do those items as well as we should be doing them. Now, the burdens include everything from toxins and microbes to toxic diet, toxic food that we're putting in our mouth, even to toxic stress and lifestyle, because this can actually cause our funnel to get clogged as well. And today, again, we're talking mainly about heavy metals. So, what is the problem? Well, heavy metals can enter through several sources: our intestine, if we're eating the heavy metals; our skin, if we're putting heavy metals on our skin or exposing our skin to heavy metals occupationally; our lungs, if we're breathing this in. Okay. And then we want those toxins to exit, and we want to exit through similar places: our lungs, our skin, our colon, our kidneys. We're urinating these toxins out. That we might be pooping these toxins out. We're sweating these toxins out. We're even breathing some of these toxins out. The problem that occurs is when we don't get the toxins out, when these toxins get stored in our system. Some places that they might get stored are our liver, our joints, our bone marrow, our muscles, and our blood. Okay, so if it gets stored in our joints, we might be then experiencing some joint pain. This is where you might get arthritis. If it's in our liver, we might be then experiencing some inflammatory conditions. We could even experience some liver pain under our right rib. Often, those with eczema can experience the liver issues, and what comes along with that is sometimes eczema. Muscle pains could be muscle aches and pains. And it's so amazing when I run cleanses on my patients and they're like, Dr. Fong, all of these joints are getting better and muscles are getting better. And I didn't even think that that was possible. I thought it was just because I was old, and it's actually because we have toxins that are stored in these areas. Okay. So it can really wreak havoc in our system. And this is why we really need to pay attention to heavy metals and heavy metal toxicity. The other thing that happens, especially for eczema people, is we can get what's called hepatobiliary dysfunction. And what happens here is that with so many harmful substances that you're being potentially exposed to, including heavy metals, your liver just can't keep up with detoxifying all of them. Liver function and bile production decrease. The toxins accumulate in your body, and inflammation like eczema can occur. So, we really need to think about this because this can really be at the root of your eczema issue. Now, what happens when all these toxins are just kind of hanging out in our tissues, maybe floating around in our blood? Well, it can really mess with a lot of different things. So, I'd like you to think about your cells as having little connections to each other, and that's how they communicate with each other. Well, what heavy metals can do is actually disrupt those communications. So, if you kind of think about like our cellular network, and I'm talking about cell phone network. Imagine if with your cell phone network, you just didn't have reception. That is what it's like when you have toxins that might be disrupting that cellular communication, that your cell phone is not getting the information that it needs. So, unfortunately, when our cells don't get the information that they need, we're going to have dysfunction. And everything works on a cellular level, but then from there, we'll have the organs that are dysfunctioning. And so then we have organ system dysfunction. And then we have the symptoms that we experience. Okay. So, one of the communication items that needs to happen actually happens with our cells, but also in our endocrine system. Our endocrine system is a system of messengers, and these messengers are called hormones. These hormones will tell our body what to do and all of the things that need to get done, everything from making babies to, creating our energy levels to fighting off disease. Our endocrine system is actually the messenger system for that. So toxins can absolutely disrupt this endocrine system, and these are called endocrine disruptors. Okay, so this can happen when we have too many toxins in our system. And what happens sometimes is that some toxins can actually mimic our hormones, causing disruption. And, heavy metals can block this function as well. So we can really see some problems here. The other thing that happens is just like when you open an apple and the apple starts to brown, well, that is usually oxidative stress that's happening on that apple. And this can also happen when we have a lot of toxins just floating throughout our system. We might have free radicals that are attacking our cells and causing oxidative stress on our cells, which basically just ages our cells faster than we need them to. And that's why we love to eat antioxidants because those will really protect our cells from this oxidative stress. And finally, some of these heavy metals and toxins can act as carcinogens that damage DNA and really can even lead to things like cancer. Okay. So often when we are seeing cancer patients, we are often seeing that these cancer patients are just loaded up with toxins. I've seen patients with breast cancer at very young ages who have high heavy metals. Some of them are coming from tattoos, and that was another exposure that I actually forgot to mention is tattoo ink can actually have a lot of heavy metals as well. Where the red color in tattoo ink can have high cadmium levels. And I have had patients who have tattoos all over their bodies. And unfortunately, they're dealing with breast cancer at an early age. And some of that could be due to oxidative stress and DNA damage, et cetera. Okay, so this is really something we need to think about, not just for eczema, but for a whole plethora of conditions that could be problematic. So, toxins like to go into our fat cells, into our tissues, into our, you know, places where they are going to wreak havoc, and especially places like our liver. Our liver has over 500 functions in the body. And when it does not operate well, we are not doing things well, like creating thyroid hormone, like metabolizing cholesterol. These are part of your liver's functions. So when the liver is burdened by too many toxins, we do see problems throughout the body. Okay, so what can you do? Number one, evaluate your home. We have to look at your body care products, your cleaning products, your water source, furniture and clothing, the materials in your home, the airflow, your pantry, your utensils, your cookware, your food. Unfortunately, heavy metals are found in almost all of these places. So when we work with patients at Clean Body, we do try to really help you to evaluate your exposures. Not only do we give you tons of checklists to work through, but we also have you journal a lot of your products. So your food, we want to see all the food you're eating. We want to see the containers you're putting the food in. We want to see what laundry detergent you're using. What bed sheets are you using? What mattresses do you have? Unfortunately, there can be heavy metals in a lot of these places, so we need to evaluate that for you. So, that can really help is just having someone on the journey with you. But of course, there's a lot of education out there, and we'll get into what resources you can look into to just start cleaning this stuff up. We really like to test for this, especially if we feel that there have been a lot of exposure. So, we have an overall test that's called the total tox burden. This is a urine test that can check for heavy metals, environmental toxins, and mycotoxins. So, just kind of all of the toxins that we might be considering. I do like this one a lot, just kind of as an overall screen. If I really feel like there's a lot of toxicity heavy metal wise, I might want to do a challenge. This is where I might give you something to chelate those metals out. Because one of the problems with just doing a urine test or a blood test is that maybe those toxins are actually stored in your system and they're not floating around. So we actually do need to do some testing that actually pulls or some treatment that pulls out those toxins, and then those toxins come out into the urine. That's called a challenge. And sometimes we might use things like DMSA or EDTA to actually pull out those toxins. And certain chelators will have affinity for certain heavy metals. So, for example, DMSA has an affinity for lead and mercury, is are two of the highest heavy metals. And then we could also just do a blood test. We could look in the red blood cells. That's one way to do a blood test that might be a little more accurate than just looking in the whole blood. We can do a hair test, we can do a stool test. And some of this depends on the age of the patients because sometimes it's hard to get blood from a patient. And so we're just going to kind of get what we can get. But there's so many ways we can check this out and really understand, whether toxins and specifically heavy metals are a problem. If I have someone that sweats and they have a problem with eczema, sometimes, I could be asking myself, I wonder if when they're sweating, they're actually releasing heavy metals that are stored in their system. And that could be part of the reason they're having a burden. So these are all questions I like to ask my patients. Now, you want to think about all the products you're buying, you want to assess your entire home. So we do have a product recommendations page. If you go to cleanbody.health/products, you can check all of these products that I've tested myself and everything from if you're thinking about heavy metals, you want to think about even your utensils you use at home. Those stainless steel utensils can actually have nickel in them. So you want to potentially buy nickel free stainless steel for your utensils, for example. You want to think about your pots and pans. You want to think about the seafood you're buying. If you go to the food and drink section of our product recommendations, you'll see that there is a company called Seatopia, and they actually check their fish for mercury and microplastics. So, those are some things to look into. You want to think about your deodorant. Your deodorant might have aluminum in it. So, our product recommendations page is a great place to start. When you are buying products, though, you want to look for certifications. And there are so many certifications out there now. So you can look for an EWG verified certification. You can look for a GOT certification. That's organic textiles with limits on heavy metal dyes. You can look at the OEKO Tex and OECO Tex standard 100. These are textiles that are screened for heavy metals like lead. That's actually a standard that you can look for when you're buying clothes, when you're buying your bed sheets. I always look for these certifications when I'm purchasing anything, depending on what I'm purchasing. Okay. And of course, if you are going organic, sometimes that does avoid not only synthetic pesticides, but also heavy metals in farming too. So, there's a lot of different certifications. I did write a blog about this, so definitely check out my blog, which will have all those certifications listed out there so you can check that out, okay? Now, I love EWG, so I told you that that was one of the certifications, and not only do they have a certification, but they just have so many great resources. They have a bunch of consumer guides, like the tap water database is one of them that's really great for heavy metals. It will show you the potential heavy metal load in the water that's in your zip code. So you can go to the tap water database and put your zip code in and see what heavy metals are in your water. I often find arsenic, unfortunately, for heavy metals. And then, of course, there's a lot of other types of toxins in the tap water. But for heavy metals, I commonly find arsenic, sometimes uranium as well. You can also look at their Skin Deep database, which is a database that looks for in cosmetics, heavy metals and other toxins as well too. But heavy metals are in the Skin Deep database as well. And then they just have so many other consumer guides that can help you on your journey. A great place to just learn about what is toxic. And then finally, we talked about the seafood, and that's a big place we're actually getting mercury, unfortunately. So they actually have a consumer guide for seafood, which is great. You'll basically put in your weight, your age, your gender, and whether you have heart disease or not. And it will tell you and give you a list of the lowest mercury, highest omega 3 foods for you, your age, your gender, whether you have heart disease or not, and how many servings you should be getting per week. So, a great resource and one that I recommend frequently to my patients. Basically, you got to start here. You got to start with what you're doing in your life, buying, clean products, looking for those certifications. The other things I recommend are just getting an air purifier to clean up the air in your home, filtering all tap water resources, making sure you're doing a good job just cleaning your home and decluttering, cleaning up your kitchen, looking at, pots and pans, looking at utensils, looking at your pantry, and really staying away also from canned goods would be preferable. And really then thinking about, okay, do I need more support beyond this? And depending on the severity of your eczema, you may want to think about getting testing and then really, supporting your organs to really clear out toxins if we do find it. And this is where you may need professional support. So all of the things that you can do in your life, those are things you can do right now, but sometimes more is needed. And sometimes we do need to do some testing and we need to do some cleansing. We need to do some supporting of the organs. Now, one problem that I do see is that people will now jump to the conclusion, oh my gosh, I have heavy metals. I now need to do a cleanse. I need to do it right now. And the problem with this is that often you are not ready for a cleanse until you actually support your core organs. You open up your drainage pathways, that would be your gut, your kidney, your liver, your gallbladder, etc. And then you cleanse. So often, people will, just start cleansing and they're just not ready for it. Their body just kind of screams out like, "Whoa, my none of my drainage organs are open, so I'm just not ready for cleansing," and yet we're cleansing, right? I have seen people with, very severe eczema who try to do this because they listen to a podcast or they read a book and they're like, "Oh, I need to cleanse." And that might be true, but we got to do some things before we get to that cleansing part, okay? So I've had patients who have showed up to my office, their initial patients, they ended up going to the ER because they were cleansing and they thought that's what they were supposed to do, but it was too fast. Their drainage organs were all closed up. Their funnel was super clogged. And so they were trying to cleanse through a funnel that was really clogged. And so that really just led to the body screaming out and they ended up in the ER. So, I would say, even though, yes, we're talking about, yes, we need to cleanse heavy metals right now, we cannot start there. We have to start. And for me, there's 4 phases. The first phase is we start with the core. What are your nutritional deficiencies? What organs do we need to support to just give you baseline help? Like if your adrenals are not working well, we need to support the adrenals, for example. Next, your skin is already starting to get better. Now we can move into the drainage organs. Let's help your liver, your kidney, your gallbladder, your gut to work well. Then we see a little bit of progress to your skin already. Finally, we get to that cleansing piece. We clean everything out. Everything's good. Your skin's doing great. And now we leave you with the 4th phase, which I call clean body for life. And what this means is that this is a lifetime process, right? We are always exposed to toxins. So it's not just about getting clean now, it's about getting clean and then staying clean. And so the clean body for life process is okay, what do we need to do to keep you healthy? Let's avoid these exposures. Let's maybe do a cleanse once a year. Let's maybe take some supportive supplements or maybe let's not. So it just kind of depends on where you want to be at the end of that process, okay? So I hope that this really helps and, really uncover whether you might have this hidden trigger of heavy metals. And, if this is something you want to dive deeper into, this is something that, I can assess you for, my team can assess you for, and we can dive into this with testing and then really figure out how to get you to that finish line. All right. If you have eczema and you have not taken my free eczema root cause assessment, I do recommend take it because then you can actually see if toxic burden is one of your highest issues. And it may not be, and then maybe heavy metals is not something to think about, okay? But it'll be really helpful to just kind of help you understand where you need to be. Thank you for joining Live with the Eczema Doc. I hope today's episode provided you with valuable insights and tools to support your journey to healing your skin from within. For more information, visit www.cleanbody.health or check the links in the podcast description. You'll find the studies and resources discussed today on my blog. You can also take my free eczema root cause assessment to uncover potential triggers or download my free eczema relief guide for quick, practical tips to calm flare-ups and help with your sleep. If you found found this episode helpful, please remember to like, subscribe, and share the podcast to help others on their healing journey. And if you'd like to stay updated with future episodes, please turn on your notifications so you don't miss a thing. Please remember this podcast is for informational purposes only and does not constitute medical advice. Always consult with your healthcare provider or book a consultation with me before making any changes to your healthcare regimen. When you clean your body, you heal your skin from within. Thank you again for listening, and I'll see you next week.